go. Here we go. Perfect. All right. Well, good morning. As Whitney said, I'm Carrie Skiles. I wanted to thank you all for being so welcoming and warm. And you've all been very, very nice and kind as I've started. And I really appreciate that. And I really am looking forward to working with all of you. As Whitney said, hang on just one second here. Why is there we go. Really today we're going to be focusing on closing out FY23. We're within just a couple of weeks, so we'll be talking about what we need to do to close out that, and then we will touch a little bit on FY24 and what the new grant year will look like. And then we also have a couple of colleges on with us today that are going to share a couple of ideas that they've implemented in their colleges that I think you all will find really interesting and valuable. So before we get started, and feel free if you, I want to discuss what your biggest success has been that your college has seen during the FY23 PATH grant year. You're welcome to use the chat feature for that, or if somebody has something that they really want to share, please jump in. I believe you should be able to unmute yourselves. So please, I just think it would be really helpful if everyone could see what types of successes you've had this year. I'm hoping that everybody can see the chat on your own end.
Harry, this is Erica White from Blackhawk. You know me. I'm always sending the emails, so you know I got to chat. I think probably as the rest of us, look at that. See, we got that already on there. I think it's nice that a lot of us have been able to help students in need kind of clear their debt, that they couldn't get financial aid, and yet at the same time they were eligible for PATH. And what a relief. We've had students, for the first time as a dean, I've had students send me notes that almost made me cry because they were so thankful that somebody looked at their financial need, thought, yeah, you deserve this, go forward, so that's been a big deal with Blackhawk.
Thank you for sharing. I have to agree. So of course, I'm kind of the outsider coming in. As Whitney said, I've done healthcare for many years. And other than my own educational experiences, this is all a little bit different. And coming in and seeing what this grant has allowed you all to do and how you're supporting your students and how creative you all are, it's been amazing to see that. And what a life-changing experience for these students. You all should be so proud of yourselves for what you're doing. And it's amazing.
I would like to pipe in. It's Kim Buck, and I'm at John Wood Community College in Quincy, Illinois. And we did some unique things on our grant exclusive item line that allowed us to meet those immediate needs that the student had. For instance, a tire. So some of our students commute 2 hours, hour and a half, an hour, and we could pay for a tire so that they could have their ability to be at campus. Mm-hmm. So that was very unique in this grant. And the students were very appreciative of being able to meet those incidentals, along with the other things you guys have spoken about. Those incidentals, though, were the things that, they weren't going to be able to manage on their own and could prevent them from even remaining in the program.
Kimberly, I'm sorry, I will talk, people, so just ignore me. But Kimberly, if you could send me, we're having a interesting time trying to figure out how to, if a student asks for a gas card or a battery for their car, how do we make that, I don't know, financially with the budget, how do we see that? Does that make sense? Does that make sense?
It does make sense.
Okay.
However, we had a grant exclusive item line, which was a nice chunk of the grant monies, so that we could, and we identified it as fees, books.
And that's what we have.
Right. And in that line item, we were able then to give them a reimbursement of their outlay so that they knew they could kind of float it.
Perfect. So how do you identify Sally? Because this has been a thing with with Dr. Lake. You know, I've asked her, how do you identify that Sally actually, not that I'm strict, but Sally actually needed the tire? Does that make sense? It's so
Absolutely.
simple, and yet I'm trying to figure out the paperwork.
Well, we just did the reimbursement piece, because if they knew that they could get those monies back to them relatively quickly, they could float that. So I had a receipt, and that allowed me to understand or be secure in the fact that they actually needed
Right.
the tire. Yeah.
Perfect. So that was a transparency portion. That's what I was kind of trying to figure out, you know? So I appreciate that. I really do, Kimberly.
Great. Thank you all for weighing in on your successes. And now we'll do kind of the same thing, but instead of successes, we're going to talk about the biggest challenge that you faced. And again, you can use the chat feature, or if you would like to speak, feel free to do that as well.
Our challenges were internally, like processes, and getting the monies spent in our institution's time frame versus the grants time frame, and we're still navigating that. And then having the students sign sheets that say they understand that the monies that they're receiving are in a category that they could be taxed on, depending upon how they were receiving those funds. Those were challenges internally here.
Good. Thank you for sharing. And hopefully, as we go into the second year, you know, some of those pieces that you've had to kind of scramble to work through in that first year, hopefully some of that will go away as we move into the second year. Looks like there are several that is more process related than anything. So
a little bit of an issue with students not being able to complete because they're just not quite ready for, I guess, the college experience, and something that we're looking at for in 24. And I'm curious to know if any other colleges do this, is hiring an embedded tutor for healthcare courses.
yes, I know just from reviewing grant applications and even quarterly reports from the last couple of quarters, there are several institutions that have tutors that are specific to healthcare programs.
Yeah, if anyone would like to reach out to me, I'm Adam Lovell. I'm at Richland Community College. I'll put my info in the chat. I'd love to chat with you to see how that works and kind of what your process looks like.
Great, thank you for that call out, Adam. Carrie, if I could jump in here, you know, as we think about the stipend piece and the wraparound support services piece of PATH, I mean, obviously this was emulated from WEI, and as you will see grants that come out moving forward, not just from us, but from federal grant programs, and then even Department of Commerce and Economic Opportunity, other state programs, you're going to see this wraparound support piece and the encouragement of stipends as a part of those as well. And so I think as you are working internally at your college, it would be best if you could think about a way that those internal processes are not just specific to PATH, right? But creating a process that truly could work for all grant programs, where there is this wraparound support piece. I'm just thinking about, you know, not having to recreate the wheel and really formalizing something on campus so that you can use that for other grant programs, because this is going to be a reoccurring feature of a lot of the grants. And so just for ease for the students as well, if you have a student who's working with WEI and then PATH, right, that they're not having to like go through separate processes just dependent on the grant. Be thinking about how to collaborate and kind of create one strong internal process for students. So just a thought that I wanted to add there.
Very good point. I think we'll move on. Whitney, did you say that you already had specific questions relating to allocations, or do you want to go ahead and go through FY23 information first?
Yeah, work through FY23, and then before you jump into 24, we'll just kind of address some additional questions that have been coming in.
Okay, sounds great. As I mentioned, a lot of what we'll talk about today on this call is relating to FY23. There are still some required reporting pieces that you'll need to finish up with the FY23's grant. The fourth quarter report is still going to be due. It's due July 30th, and it's going to cover April, May, and June of 2023. You're going to use the same template that you've been using for the previous 3 quarters, which will include the financial and the performance narratives. And actually, we would appreciate it if you could use the same document, and most of you have been doing that throughout the year. But if you could use the same template, and that way it builds on each quarter so we can see cumulatively where you're at. And again, once you finish your report for quarter 4, you can send that to the ICCB grant payments email address, and you're welcome to CC me on that as well. And then this is just a quick screenshot of the financial piece of that. And as I mentioned, it is cumulative. So you should have already seen quarter 1, quarter 2, and quarter 3 numbers in your report as you finish your quarter 4. And then it will also show you your remaining balances, which we hope will be 0 when you report out your quarter 4 numbers. If you think that you may still have some funds that you're not going to use, we need to know that as soon as possible so that we can move forward and decide where we'll go with that. And then, as I also mentioned, your template also includes your narrative piece with your tabs down at the bottom. There would be a quarter 1, quarter 2, quarter 3, and a quarter 4 tab. You'll work from your quarter 4. And again, you're going to include cumulative information. So you'll have all of your PATH programs that you have, your SIP numbers, and then whether they're credit or non-credit. And then I know there's been some confusion throughout on your numbers of students. Make sure as you're calculating these, this is cumulative. So you're going to total the number of students enrolled, and that's going to include your previous 3 quarters as well as your quarter 4 numbers. And then the same for your incumbent workers and also for your completers. And make sure that you take credit for all of your students that are enrolled in your programs. There's been some confusion as well on thinking that the only students that you can count are people that have received PATH funds directly, but that's not the case. We want you to include everybody that's enrolled in the program. So definitely don't forget some of your students, like maybe your high school students that are dual credit. We want you to take credit for those as well.
Can I ask a clarifying question here?
I do too. So go ahead, Kim.
Okay, so I've had mixed information about this element. So I did not include with funds, so they did not receive funds. I did not do allocation to my EMT and paramedicine program for the 2023. And then I was told, no, if it's anything medical, anything of that nature, we can include them. We can include those numbers. And so we were going to try to get those numbers included and on this particular report. And then I was told, no, if you didn't have any allocation of funds to that particular program, or if they didn't get funding from the grant path or the PATH grant, then we could not count them. So I'm sort of confused. And also, is this where we're putting the summer prior to us being able to even apply for the grant? So it would have been the summer of 22, right? So this started July of 23. So the June and before, would we be able to apply those people, like our CNAs that graduated, those sort of things? I'm just needing some clarification.
Sure. So to go back to the first question with the EMT, the EMS programs, paramedics, did you have those listed? Are they allowable programs within the grant? Do you know?
So they were allowable per your instructions,
Mhm.
right?
Mhm.
But we had not listed them initially.
Okay, within your grant application. So Whitney, correct me if I'm wrong, but I think we could actually, if you wanted to add those in, we could do that so that you can count those in your numbers.
Yeah, so I think the reason there's been some discrepancies is initially when we put out this grant, we wanted you to only capture within the quarterly report those that were being supported by PATH. It didn't mean that they have to necessarily receive funds, but we wanted to differentiate between, to show that there is an effect, right, of the PATH grants. We're focusing in on the program. So, however, ultimately, the data that we're going to get from the longitudinal data system, right, the research and policy studies, is going to include all of those students, even if PATH did not touch them. And so we had kind of told colleges in this year, you could sort of do it one of two ways as it relates to the quarterly reporting. You could just focus in on the programs that you listed in your program offerings chart, or you could be all encompassing and list them all. And so we are going to shore that up a little bit when we get to the supplemental report, which Carrie will talk about in a little bit. So for quarter 4, just do it how you've been doing it the past few quarters. So if you've been focusing specifically on the 6 programs that you're focusing on with PATH, report on those students, right? But we know, right, that our longitudinal data system is going to encompass all of those programs. Okay, so that's what your allocations are based off of, for clarification. So the numbers you're reporting here aren't driving allocations. We're getting that through the longitudinal data system. Okay. Next year, we're going to be changing the quarterly report so that we have a little bit, so we have some differences, right? We're going to be asking about students that are supported directly by PATH. We're going to be asking for those numbers. We're going to be asking about enrollment and completions in the programs supported by PATH directly. And then we'll probably have a separate sort of reporting for you guys just to keep track of kind of where you are in terms of enrollment and completions for programs that maybe you're not supporting with PATH, but that are going to affect your allocation, right? And your target completion, just so that you're able to track it. But since this is a grant, right, and we're focused on how the funds are being spent on the grant, that's kind of why it's a little bit of both worlds. And so that's sort of a flaw with our approach, but ultimately we know that many programs are indirectly going to be affected by PATH. And so that's sort of the reason. Your question about summer, don't include them in the quarter 4, but yes, in the supplemental, we'll break it down so that you know that summer 2022, right, is included in that final supplemental. And that is included in sort of your 23 grant program. Okay. Sorry, clear as mud, guys. We're trying to shore some things up. You know, we had to get this rolling quickly too. So we appreciate your patience as we move through this. But ultimately, the numbers that are coming from research and policy studies is what's driving the allocations.
So can I ask a question? And I'm a simple woman, so just excuse me for this. So if I have a nursing cohort that's a ADN, whatever you want to call them, degree, and they started in 2021, right? Because it's a 2-year program. Everybody with me? So how do I count that? How does that fit into the grant? Because really the grant year was from 22 to 23, the first, you know what I'm saying?
Yeah.
So how does that work? And I started in January. So if you guys could kind of give me the lowdown, sorry, as to how you want that documented, I would really appreciate it. Because when you look at completers, some of them don't fall into that grant cycle. So how do you want that documented? Does that make sense?
If they completed prior to last summer, they won't be counted in this grant year, right? But if
Perfect.
they completed, if they started in 21 and completed last fall, right?
Or this last May, right?
Right. They are counted as an enrollee because they're enrolled, and then they are counted as a completer.
So how do we do our attrition? So let's say they started in 21, okay, and they didn't make it through 22, which
Okay.
would have been their first year, whatever. How do we do that attrition? Because the grant really didn't start. I'm sorry, I'm complicating this. The grant really didn't start until 22. Does that make sense? And they didn't complete and it was May of 22, and the grant would have started in July. Is that true?
So, yeah, the grant started in July. So if they did not complete in May, so
I know it's
we're
complicated.
only looking for those who were enrolled starting last summer for your summer semester and or completed in the summer semester and beyond.
Okay, so if I lost, let's say 5 students in that first year before the grant started, I do not have to count them. Is that true?
Correct.
Okay, that's all I need to know. Thank you.
Yes. Yeah. So you're thinking about a cohort that started 2 years ago and tracking. Yes. So yes, you're just looking at year to year. Simple.
Are there other questions on the numbers of enrollees or completers? I know that gets a lot of questions. I am going to back up for 1 second on the budget information on the financial piece. There have been a couple of people that have reached out that have accrued interest because you received those first 3 payments automatically. Some schools have accrued interest on that. If that is the case, you will just want to make a note on here that you show that you spent your grant dollars plus that interest that was accrued. So you'll show it here in your numbers, and then you'll also show, you can make a note somewhere in the report that what that accrued interest was and that you spent it on your expenditures. And if there's any questions on that, definitely reach out directly and we can get you more guidance. Okay, and then this is just another slide to show you a little bit more information, again, just as a reminder, to make sure that you're including all of your students that are in your allowable programs, and then making sure that you are reporting that cumulatively over the 4 quarters. And then, as Whitney talked about, we are going to ask that you do a final supplemental report. This is going to be due August 30th. It's going to be similar in format to your quarterly report that you've been used to seeing. It will be an Excel spreadsheet, and it will have tabs at the bottom with different information that we would like to see. And again, you'll send that to the ICCB grant payments email address, and you're welcome to CC me on that. It will be cumulative information over the entire FY23 PATH grant year. We are still working on developing that and getting that finalized. As soon as we have it, we'll get that sent out to you so that you can start working on it. But some of the things to be thinking about that we will be looking for in the report, we are going to ask for those final numbers of completers, both credit and non-credit, as well as the final number of enrollees. And again, that will, if you need specific assistance, we can certainly do that as far as your calculations. But I know there's been some confusion over your quarterly reports, so this will give you a chance to look back over the entire year and make sure that you're counting everyone. We're also going to ask that you share successes and challenges that you've seen through the FY23 grant year. We also want you to share with us at least one student success story. If you want to share more than one, please feel free to do that. We would love to hear stories of, ways that this program is supporting students and ultimately moving them out into the healthcare workforce. So please share those as you would like, but we definitely would like one of them. And then we're also going to look for some information on employers that you've been engaging with. So what types of employers you're engaging with, whether they're hospitals, nursing homes, some type of a clinic, how many students were hired with those employers, and also include your incumbent workers. Maybe they were already a dietary staff member and they moved up to become a CNA or a phlebotomy in the lab department. And then also we're wanting to know information on what types of occupations those students were hired for. So again, was it a CNA? Was it an RN? Was it some type of a tech? And so all of that information will be recorded in that final report. And again, we will get that as soon as we can to you. Let me check and make sure on the chat. I'm gonna look really fast and see if there were some questions. So you've included active students in any eligible program as of July 1 through June 2023. It sounds like this is potentially wrong, but we'll get sorted out. No, you're correct. As long as you have those programs and you had those listed within your eligible programs, you should be okay. But yes, ultimately we will get that data on our end. Okay, let's move forward. The other thing that we wanted to remind you about to finish out the FY23 grant year is your final payment request. You should have received the first 3 payments automatically. They would have come with execution of your grant agreement within October and then within January. But the 4th payment you will want to submit for your remaining balance of grant funds. You're going to want to submit that to the ICCB grant payments email address, and the deadline to do that is no later than August 1st. So please make sure that you keep that in mind as that will quickly be approaching. And this is just kind of a
She froze there for a second. These are just important dates to remember. She kind of walked through these here.
Whitney, this is Karen Weiss. So the 4th quarter report is due July 30th rather than June 30th, correct? That's what I'm reading on the screen.
Yes,
You
they're
said
always
June
due.
30th before, so it's July 30th. Okay.
Yes, the 4th quarter ends June 30th, and so 30 days after, like our other grant programs, will be the 4th quarter report, and then the supplemental will be due a month after that in August.
Okay.
This is Jeff Johnson from Harper. We had a question on closeout on outstanding purchase orders. We have some purchase orders that have been committed. The amounts have been encumbered. They're in the pipeline. They've been sent to the vendors for fiscal 23. Some of the vendors have informed us, though, that the items will not be delivered until after July 1. So we just wanted to verify that we can still charge those amounts to fiscal 23 as long as we get them within 90 days of the end of the grant. Is that correct?
Yes, generally, yes. And we can always, if it's going to be later than that, we can send out a memo sort of allowing for that extension. I know that shipping and supply chains are starting to get back to normal, but we know that there's still some things taking some time. So yes, you don't have to receive it by July 1st.
Okay, but we're still subject to that. In general, we're subject to the 90-day limitation, right?
I don't know the exact time. It's 60 or 90 days. Yes. So
Okay.
we could find that out.
Thank you.
Mm-hmm.
I apologize, my internet is not stable. So I think I got disconnected. I'm not for sure. Whitney, I don't know what the last thing was that you heard from me.
You were about to, I think, transition off of this page. So
okay, perfect. Are there any other questions that anyone was asking?
I just want to be sure that you guys are going to send this out with the recording to us post
Yes,
conference. Thank you.
we sure will. All right, so moving on, we do have actually, Whitney, why don't we go ahead and address the FY24 questions, and then we'll do.
Absolutely. So I'm just going to kind of walk through very quickly because I know we have some excellent sharing of ideas from College Lake County and Sauk Valley on some innovative things they're doing, but we received a number of questions about the allocations, and so there were some shifts this year, and so I just want to make some clarifying statements so that you all feel comfortable with where we are. So a couple of things. One, this allocation formula is in rules, so we did follow it per the rules. It is based off of the most recent academic year's completions. So that would be academic year 2022 that ended June 30th, 2022. And remember, that year does not cover anything that happened in PATH, since this was the first year in PATH. So we have a few colleges that said, well, I hit my numbers, or I'm going to hit my numbers. How is that possible? It doesn't account for any of the work that happened in 23. This next year, right, all of your work in 23 will encompass that. It does not encompass non-credit completers because we did not have a mechanism for collecting that. We will moving forward. So we are very hopeful that next year's allocation will include your non-credit completers from 23. Okay. Because in addition to sort of the $100,000 base that everyone gets, because we're at a set sort of $25 million, if one college or a couple colleges shift significantly increases in their completers, right? That's even if you stayed the same, it's going to shift how you receive your funding because there's not enough resources. So the rate in which you're going to generate funding for your completers is going to be lower. Okay, so your allocations are dependent on your completions, but also really dependent on everyone else's shifts if there are any major shifts. So you're receiving your allocation, so $100,000 base, and then what we did is the data that you submit through the longitudinal data system for all of your healthcare programs were removed completers from the non-eligible PATH programs, right? So it just includes the list of the PATH eligible programs. So if you're looking at your data and saying, you know, our total doesn't equal what you have, make sure that they are excluding those non-eligible PATH programs, 1. 2, we also excluded, which wasn't the case for the first round of allocations, but we found sort of an issue, and so we needed to shore that up. We also excluded, let me pull it up here so I can read it correctly. Let's see here. To account for auto awards, so that we were excluding that. We excluded those that were not also enrolled in that academic year where that completion was reported. Okay, so it's not a perfect match, but it pretty much excludes any sort of auto awards. And we had a few programs that had some pretty significant shifts because of that. Otherwise, the priority SIPs, which are those 7 SIP codes, are weighted higher, and the rest of them are roughly, the formula is ran so that they're receiving about 2/3, generating about 2/3 what the weighted SIPs are. And so this is spelled out in the email that Carrie sent to you. This is spelled out in terms of the FAQ that was sent out, and it's in the program design. And so if you saw a decrease in completers from academic year 2020 to 2022, your allocation likely dipped. If you saw an increase, right, it likely increased. Some of you had decreases more so in the priority areas, right, which are weighted higher. So that equated to a larger shift, either down or up. And so again, it's really based on your completions. And so it really emulates that. Any specific questions outside? I know we individually responded, but we just wanted to make sure that everyone sort of understood. So the 25 allocations could dramatically shift. So if everyone sees an increase, right, they won't dramatically shift. But if you have a few colleges that really boom and others that do not, then yeah, you may.
I have a question, of course,
Mhm.
because I'm new to the grant as of January, but I'm wondering, I need some input. For those students who are dual credit, let's say they're CNA students, how are people handling that as far as completers and the PATH grant, anything? I just kind of need to get that feeling. How do we count them?
So they're included in your enrollment and completion, right? Because they are
Right.
Some colleges are really focused on that pathway from that, you know, that high school to college pathway, and transitioning into the college, and others maybe are not focusing on that for this grant year.
So my question is, what is the grant? I hate to throw this back, but what does the grant expect as far as data?
So those would be students, they would be enrollees and they would be completers.
So they would be counted as the community college students, right? They're
Yes.
not counted as high school students. They're counted as our students, true?
They're enrolled.
They're enrolled and they're completed. You wouldn't report them to us as high school students. I mean, they are duly enrolled. So
Right, that's what I mean. So they're counted as our students in the college, the up, higher ed, but they're not counted, whatever. So they're counted as higher ed. But at the same time, even though they're being educated in K through 12, right? We're okay with that.
yeah,
You know
I
what
mean,
I'm
I
saying?
think, yeah, I think
College
Erica,
level.
we can have if any of the other colleges want to sort of chime in here, but I think we
Well,
can have
that's what I'm asking. Does
Yeah.
anybody have a pathway or thoughts about that? That was my question, and I can talk to you and Carrie, no problem, off. But I'm just wondering how other people are dealing with that, so.
yeah, would a college that is focusing on some of their dual credit pathways like to weigh in how they're utilizing funds and supporting those students?
We are not using PATH funds to support our dual credit students. We have quite a few students in the B&A in the high schools. And we have agreements with those high schools where there's a reduced tuition rate. The students aren't paying for their tuition, their district is. So we chose to direct our direct student support money to students that are not in the dual credit in the high schools.
That's perfect. That's what I'm trying to get at. So I apologize if it was a little convoluted. So I'm just kind of trying to get a feel for what other people are doing with those dual credit students.
This is Kathy Swinson with Illinois Eastern. We have what we call a health careers program at 3 hospitals in our district. And I've met with 2 of those hospitals, and what we're going to do for fall is buy new textbooks they teach CNA and they teach medical terminology as part of their program. So we're going to supply those out of PATH, and they'll remain with the program for additional years to help them out. We also bought a lift for one of the hospitals for their CNA program. So things like that to support them and
Thank
to
you,
get in
Kathy.
and talk about incumbent workers. So
Yeah, thanks, Kathy. I appreciate that, because I'm just trying to get a feel for, how other people are doing it, and so that we have that equitable thing. So thank you.
Yeah, all great questions. All right, any other additional questions regarding allocations, please just send Carrie an email and we can chat offline. I do want to save some time for our college peers who are going to walk through some of their innovative things that they're doing.
Yes. So first up, we have College of Lake County, and let me stop sharing here for just 1 second, and I'll switch my screen. They developed a graphic novel specific to the PATH program that they could share with students. And so they have developed a presentation for us. Let me share that. And if you are ready to go.
Good morning, I'm ready.
Perfect.
Okay, so Carrie, are you gonna help me with the translation of the slides?
Yes.
Wonderful. So my name is Jeet Sani. I'm the Dean in the Allied Health area at the College of Lake County in Grayslake, Illinois. And one of the innovative things that we did using the PATH grant was develop this comprehensive marketing campaign to recruit students into the program. So next slide, please. So what we did was we partnered with our colleagues in marketing and PR before we wrote up the implementation plan last year, and we set goals for our marketing strategy. And the PATH program allowed us to allocate a handsome amount of money. So we allocated $75,000 for the total marketing campaign for the program. We developed a team to lead that initiative. And then we executed the strategy. And what you are seeing in this image here is our graphic novel, which is an actual printed document that is also available to hand out and also available on our CLC website. Next slide, please. So when we partnered with our colleagues in marketing and PR, while we were submitting the implementation plan, we shared our, path documents with them, along with what our institution's mission was. And then we developed a shared vision for our marketing plan, which was to increase the diversity of our healthcare workers. And the best way to do that would be to get diverse students from traditionally underrepresented backgrounds in our healthcare programs, especially from communities where we knew that cost of education was a major concern. So what you will find out in one of my future slides was we targeted this campaign on some of the communities from areas that are economically depressed, and also areas with high amounts of students from traditionally underrepresented backgrounds. And we also wanted to try something innovative. So next slide, please. So we worked with our colleagues in that department, and we decided to develop a graphic novel. Now, full disclosure, I'm not somebody who's good with the arts, so I'm not going to take credit for this, but our colleagues in that department are very innovative. So they thought it would be cool to develop a graphic novel, and we can target the types of students we are trying to target to get into our healthcare programs. And we can also target the communities that we are trying to target, so that we could diversify the workforce in the community and the students in these programs. So they thought it would be a unique advertising effort. So this whole graphic novel is based on these three characters that you see. Elena, who is a Black female radiology technician, Lucas, who is a Latinx surgical technologist, and also Titus, who works in the food court at the hospital, who is a gender non-conforming recent graduate. And the way we came up with these characters was we used narratives, which are the way we came up with these characters was doing a lot of research on what our what recent healthcare workers went through, what recent high school graduates who have not come to CLC have gone through, and things of that nature. So all of that research was done by our colleagues in PR marketing. And in this graphic novel, we use narratives, which are an engaging way of advertising, because they provide relatable experiences for the reader, enabling them to put themselves into the story. Next slide, please. And all of this was done in-house. So Jesse, who is a marketing analyst, and our in-house graphic designer, Maddie, did all of this work. And as I said, several hours were spent researching and combing through personal narratives of people who were negatively impacted by healthcare interactions. And all of those stories were condensed into these two characters, Elena and Lucas. And then Titus, who was the worker in the food court, his story was based, their story was based on...
And you're like the only living soul.
So Zach, can you please mute yourself? Thank you. And Titus' story was researched by looking at personal narratives of high school students between 2000 and 2022. And then the story was authored in the classic hero's journey story arc, which don't ask me what that means, by filling out references that would be identifiable to our students. Next slide, please. And then we printed about 5,000 copies of this graphic novel, and we gave that away at various events at the college, and also made them available throughout the college and in our community. We would give those to community members when we would go to community events. And then the targeted communities where we were, where our intentional focus was to recruit students from, we put an ad on the PACE bus. And also in one of the target communities, we placed this ad at the PATH bus stop. And then we did a campaign on radio ads, an email marketing campaign, newspaper ad, a large sign, Google ads, and so forth. And all of that has been ongoing and will end on June 30th. And I just want to reiterate that the marketing efforts were concentrated in specific communities with higher percentage of residents from traditionally underrepresented backgrounds. For those of you who are familiar with Lake County, those are the communities of North Chicago, Zion, Waukegan, Round Lake, Mundelein, and Beach Park. Next slide, please. And then, on the website, as well as on the printed graphic novel, we use QR codes where students could just scan the code and would take them to the right appropriate programs, and also to the PATH website where all of that information was going to be available for them. Next slide, please. And these are just some images from the actual graphic novel. I highly recommend that you go to the College of Lake County's website and read that graphic novel. It is very simple. I believe it is written at for somebody who, at an 8th or 9th grade reading level. Very simple. It highlights how a healthcare program and a career in healthcare can change your life. It also focuses on how somebody like Titus, who is working in food services at a hospital, can go to CLC even if they're a non-traditional aid student, and utilize all the support services that exist at the college, including advisory, free tutoring services, access to the share market, and so forth. So it was just something that we thought would appeal to the the traditional age and the non-traditional age students that we are trying to get into our healthcare programs. Next slide, please. And for some reason, they included a cartoon of me in the novel as well. And my biggest focus is that, the PATH grant has given us such a generous allocation that for students who are trying to, who are considering college, but are unable to make the financial commitment, that financial barrier is not there. So that is one message that I've been trying to communicate to everybody at the institution, as well as the community, that we have this wonderful PATH grant, and cost is not a barrier if you want to get into a healthcare program. So that is all. So a lot of the questions could be answered by going to the website, but if there are any quick questions, I'd be happy to answer them.
I have a question.
Yes.
My question is, how do you, and this is something I'm trying to work on, how do you work with students who English is not their primary language? So do they have the ability to translate Google Translate is a big deal, right? So do they have ability to translate this into a language that it's easier to understand for them?
Oh, that is a very good question, Erica. So unfortunately, the graphic novel is only available in English at the moment, but the idea is to guide the students to our college website, where we have services available to get information translated into multiple languages, not just Spanish, because we have in our county students from multiple backgrounds, not just Spanish speaking.
Exactly. Thank you so much for that information.
You're welcome.
Perfect. Gee, thank you so much for sharing that. And Brett put in the chat the link to the website to go straight to College of Lake County. So please definitely check that out. It really is a great creative use of highlighting the PATH program and healthcare fields. Let me go back here to share my screen back. And we also have with us, we have Sauk Valley Community College, and they do a family night event at their college, and I wanted to have them share that with us as well, as another way to support your students. So Pam, if you're still on,
yep,
you could share that.
Sure. So I don't have a lovely presentation, but we call it significant other night, family friend night. It kind of depends on whatever works for your college or community of what you want to call it. But we host it usually in September one evening, and it takes about an hour is all. It's really kind of quick in and out because people are so busy. But we didn't do it during our COVID years, and people really missed it that had heard about it. So we brought it back again last fall. And what it really contains is the students get to invite their friends, their family, significant other, whoever's important in their life, or somebody that maybe is interested in the nursing field. So we hosted it in our cafeteria generally. Last year, our cafeteria was full. Almost all the students came and brought their family. So it was a great night. But really we have a night that they can come in, they meet the faculty, they meet the dean, our leaders that are in the program. Kind of gives them a more of a personal touch, puts a face to those names when they're talking about the faculty as well. We also give them a tour of the facility, our labs, things like that. And they enjoy that, to see our high fidelity mannequins, all the things that they're doing during the practice. Brings the family into the program a little bit to understand what they're going through, because we know nursing is obviously quite stressful and when you're working on that. We also have speakers that come in, past students that have just graduated maybe the previous spring in May. Some of them bring in their spouse or significant other as well, and they talk about their journey through nursing schools, trying to support that student. And then we have a different array of students. Some last fall, one was married with children and didn't work. One was a single mom and was trying to work and go to school. Another one was just a single student, young, and trying to navigate and be successful through the program. So it was a diverse group of people talking about their experience. But having that significant other and that spouse was really interesting too, for them to talk about their journey. I would recommend having some prep questions available that the speakers have, that because sometimes people are quite quiet and they don't know what to ask, or they're shy. So if the speakers have questions or comments ready, and same with the faculty, and our dean at the time had some preps to get the conversation going. We also had giveaways through the entire thing. So they put their name in for drawing. We gave away a lot of swag for promoting Sauk Valley Community College and the nursing program. And then we also had some other random things too. Amazon cards, gas cards, things like that, that we gave away. We have a section that's set up for any children that might come, that maybe it's a little long and whatever. So we have some of our nursing students that came in and they sat in an area for the children as well. Had coloring, games, activities. We had snacks, things like that set up for for everyone. But the child area was really nice. If they were comfortable in that area. And so a lot of the parents stood over there with their children too. We also want to include, we have a full-time retention specialist that we, in the program. So we really, really encourage our students to go in and see them at least 1 to 2 hours a week. And so we talk about those things of like, you need to come in and you need to have some tutoring, whether you're doing really well or not. It's always good to come in. And we talk about when we tour the lab, to practice in the lab, refresh those skills continually, how much time it takes to study, really trying to bring in those elements so that this new student especially understands, as well as their support system. So whoever it is, if it's family, friend, whoever, that they get that whole experience to understand they need a lot of support. Their lifestyle is going to change during the nursing program. So it's been really successful for us in the past. We'll do it again in the fall as well. It doesn't cost a lot of money, but we are using a little bit of our grant money as well to expand on that swag, that giveaway, those type of things. So that's kind of it in a nutshell. If you have any questions, please let me know or jump in. Is there anything in the chat?
It looks like, let's see here. John A. Logan is looking at doing some type of an event similar, maybe on a smaller scale in August. And then as Whitney commented, it's just such an important piece to have that family support for the students and to see their involvement. And this seems to be a really great way to reach that.
Yep. it is. It's been really successful for us. So
Yes,
it
definitely.
doesn't take a lot of time. Like I said, we usually burn it out in an hour. So, yeah. Okay, thank you.
All right, it looks like Carrie has potentially lost internet connection again. Thank you so much, Pam from Sauk Valley and Jeet from College of Lake County for sharing your wonderful experiences and some of the innovative things that you're doing with these funds. We really appreciate it. We'll probably be looking in the future for other colleges if they want to share any information or best practices with us. We'd like for this to be something that we do on a regular basis in these learner communities. So as far as I remember from looking at the presentation that Carrie sent me yesterday, oh, here we go. All right, I think she's back.
I'm so sorry. My internet, I don't know what is going on.
She's in the office, by the way, and the internet's not working, so that should tell you something.
Yes, I even moved to a different office thinking that that would be better, but maybe I should have stayed put. Yeah, so thank you, Tasha, for jumping in. Yeah, so, you know, just one thing to keep in mind, we will be doing another learning community in July. We're looking at July 18th at 10 o'clock, same format through Zoom. We'll send a meeting invite out to the listserv so that you can put that on your calendars. And this will be more of a kickoff for the FY24 grant year and looking at things that will be coming up through the year, as well as talking about the 3 cohorts that will be a new piece. So definitely save the date for that. And just a reminder, there's a lot of great resources on the ICCB website. There's a page specific to PATH that has a lot of great information. And if you are not on the ICCB PATH listserv, please reach out to me, or if you have a colleague that would like to be added so that we can communicate back and forth with each other, that would be great. Send me an email with their name and their email address and we'll get them added. And then really, if you have questions, and for the sake of time, please contact us. We're more than happy to help in any way that we can. Here's Whitney, Tasha, and myself, our contact information. But otherwise, I apologize, we're a couple of minutes over, but thank you all so much for joining us, and please reach out with any questions that you might have. And like Tasha said, if anybody's interested in presenting something that you're doing at your school at a future learning community, please let us know. Otherwise, have a great day and enjoy the beautiful weather.
Thanks, everyone.
Thank you.
Bye-bye.